Today we're going to be speaking about patient-centered care. This is a truly landmark, revolutionary concept, if you will. It really started, I guess it got momentum at the beginning of around the year 2000 with a study done in the U.S. called Crossing the Quality Chasm, a new health system for the 21st century. There's no question that there was thinking about patient-centered care, and in many respects it was part of what most people did as a matter of course, is they were focused on the patient. However, I think the key thing about this documentation is it really brought it into the mainstream as a major theme. Historically, healthcare facilities have been largely focused on the provider's view of the world, with the assumption that what the providers thought was best for the patient was indeed best for the patient. Certainly expectations, the rise of consumerism in society, increased information as a result of the net, all these factors have created a very different environment where people today expect and deserve to be treated as peers, even though the gap in knowledge may still be significant between the provider and the consumer, that is the patient or client. Nonetheless, in today's world, the patient/client does expect to be treated with respect, with dignity, and they expect to be involved in their decisions as an equal participant in the decision-making process. So this notion of being respectful and responsive to individual patient preferences is now become known as patient, and more recently perhaps as family-centered care. And as I described, it's a way of looking at how we deliver care that is involves the patient and the family. Concepts like dignity and respect, treating people with respect, information sharing. So it's important that that providers, that clinicians not only share their thoughts in terms of what needs to be done, but they also need to provide a significant amount of information with respect to what the options are, what's really going on, where there's uncertainty. In other words, enough information that the patient can actually become involved in the decision-making process, which leads to the next key principle, which is participation, that there is an active opportunity, a real opportunity to participate and collaborate. So those are the key principles that are involved. One of the key challenges for healthcare organizations and for providers is, okay, it's fine to say that that's what we want to do, but how do we actually implement it? How do we make this concept real? Well, there's certainly a lot that needs to be done and can be done. It starts with understanding what are we trying to achieve, how do we go about it on a day-to-day basis in our interactions with patients, how do we align our policies and procedures, how do we align our workplace processes. Often lean and quality improvement techniques can be used to assist with this matter, to look at where there might be barriers or problems. How do we create the time necessary to have these meaningful interactions when people are already run off their feet? So part of the challenge is process redesign to accomplish that. There's other things that we can do too, having very good patient-family guidebooks that provide an outline of what's going to happen and how they can get access to information. Make sure that there are staff available to provide interactions. It may be such that the reality may be such that we can't always have a physician or the primary caregiver being the one that can spend time with the patient. So what are the other options? Are there other staff members that can do that? Do nurses feel empowered to have conversations with the patient and family, or do they feel that they have to defer to the physician? Lots of things to think about. And that's, I would encourage you to look at the readings and at the PowerPoint presentation that's included as part of your package, and to think about how you can make the patient experience better and how you can implement patient-focused care.